entering the room. Please do introduce yourself in the chat, say who you are and where you're from, and then as more colleagues join, we'll kick off the session. Brilliant. Let's make a start. So a huge welcome to everyone that's joining us this afternoon. I'm Miatta Fahnbulleh. I'm Chief Executive of the New Economics Foundation, and I'm delighted to be chairing this webinar on universal quality care, transforming the adult social care system in England. This is a joint collaboration between ourselves at the New Economics Foundation and the Women's Budget Group. And today we are doing it to launch a new paper on universal social care and how we believe that we can transform the adult social care services. For me, for us, universal care feels absolutely urgent and absolutely salient. I think for everyone, the pandemic has shown us just how broken our care system is, just how in crisis our care system is. But the roots of this problem have been with us long before the pandemic. We know that we have a care system with a high and rising number of people who have acute care needs that are not being met. We know that the quality of care is not always to the standard that it needs to be. We know that our system is desperately underfunded and has been for many years, and that people who are doing some of the most vital work for our society are not looked after and they're not paid well enough. And yet successive governments have failed. They've failed to get to the root cause. They've failed to solve a problem that they have known has been there for a very long time. And when we do have a debate like we have now around care, the solutions feel like they're technocratic. They feel like they're playing around in the margins rather than going to the root cause of the problem. And this is where we come in, and this is where our report comes in, because our argument is that the scale of the problem requires fundamental reform, and we think there is a pathway to this reform. And this paper sets out the first steps towards doing that, what a reform package could look like, how we fund it, and how we get to a care system that is not only universal in its nature, but delivers quality and fundamentally pays those people who are doing absolutely vital care work the level that they should be paid in order to deliver that service. We've got an absolutely cracking panel to introduce us to both the reform ideas, the modelling, the analysis behind it, how we do it, and some of the challenges that we face. So kicking us off will be Anna Severwright, and I hope I've got that right. She is co-convener of Social Care Futures that's focused on raising the aspiration for social care based on her experience of interacting and seeing the care service firsthand. We're then going to hand over to Marianne, who many of you all know, Chief Executive of the Women's Budget Group, who has been working tirelessly on this issue, working tirelessly on how we lift the caring economy at the top of the political agenda and both deliver on the opportunities, but fundamentally deal with some of the challenges that it also faces. Next will be our own Daniel Button, who is a senior researcher here at the New Economics Foundation, leading the work that we've been doing alongside the Women's Budget Group on both social care and the caring economy. And then finally, Jerome who will be talking to us a little bit. He's a senior lecturer at the Open University who's been working closely with the Women's Budget Group for over 12 years and doing lots of work on social care, has been absolutely critical to the piece of work that we'll be together, and we'll be looking at some of the analysis and modelling that sits underneath that. What I would ask you is please put your questions, your comments in the Q&A box. I'm hoping we're going to have a lively, a very open debate and discussion over the course of the next hour, but I hope a really hopeful one. We know there are big problems, but I am definitely emboldened, inspired by the fact that solutions that are big enough and radical enough to respond to the scale of the problem are being put forward by colleagues on this conversation. So enjoy, and I'm looking forward to the discussion as we move forward. Anna, can I hand over to you to kick us off, please?
Thank you for having me, and good afternoon, everyone. So it's great to be here with you. I want to say I'm not an economist or anything like that, so I'm going to leave all the technical stuff to everyone else, but I'm Anna Severwright. I'm one of the conveners of Social Care Future, but I'm also a disabled person, and I employ personal assistants using a direct payment for the last 10 years. So that's kind of where I'm coming from in what I'm going to share with you today. I'm just going to share my screen, and hopefully you'll be able to see a few slides that I've got. So there we go. So I think the first issue actually is like, what is social care? Because actually when you speak to members of the public, speak to some politicians, you speak to the media, often people just think of residential care homes, but actually that's quite a small part of it. So a third of people who draw on social care are actually working age adults, people with mental health challenges, learning disabilities, physical disabilities, and then also people in later life. There's people who are completely privately funding themselves, there's people who are state funded, there's loads of unpaid carers. So it's a really massive thing that we're talking about in social care. I think that's part of the challenge often for this kind of challenge to how to fix social care. And as was mentioned previously, unmet need is increasing massively due to COVID. I think it's got even worse. And we're certainly seeing that less people are getting support and they're being charged more for the support they are receiving. So I'm going to start on the kind of negative and say, we're in a situation where most people I speak to sort of describe accessing social care as a fight and a challenge. And there's a lot of fear as well amongst people that their care is going to be cut. This was this week on Twitter, this lady called Sophie, her support's being cut from 24 hours a day to 15 hours a day. And she has been told that she can't go to the toilet without assistance from a PA and to wear pads, but she's not incontinent. And how have we got to a system where it is acceptable to tell someone that going to the toilet isn't actually a priority? And I think, I've had to choose in my life between sometimes having a shower or going to Tesco's because I don't have enough hours. And it's those kind of things that people are facing. And then in later life, we have a system that doesn't really give anyone any support until they get bad enough. And usually that means they've hit a crisis. They're either in hospital or their family can't cope anymore. And then often the decision is taken that they need to go into a residential care home. We're not trying to help people early, prevention, keep people well, keep people at home. So I think we need a big shift. So now I'm going to try and change, because I think I'm an eternal optimist, although I have days where I don't feel particularly optimistic about social care. I don't have all the solutions, but here are a few thoughts from me about what I think might help. So first thing I want to say is I don't think it's all about the money. Don't get me wrong, local authorities, budgets have been cut massively and they're on their knees and we need more money. But at the moment, the media, the politicians, the narrative is all around how we're going to fund social care, mostly around how we're not going to have to sell our homes, which actually misses working age adults out completely, but also is just about, you're talking about how to fund something, but not describing what we're trying to fund. And I think if we pump more money into the same system, it's not going to work. We're going to end up with more of the poor quality and the situations that we have now, and it's not sustainable. So actually we need to be talking about what we want social care to be and what it should be, and then how we're going to fund that. And one example for me, I think, is that actually commissioning is a massive problem. So at the moment, councils commission services and then our lives are expected to fit into those. So when I said I needed a few more hours of what's awfully called social inclusion, because actually I had 4 hours that I could get out of the flat with a PA, and I wanted to be able to do things with my friends. They came back and said, well, we can refer you to a befriending service. And that is because they'd said, isolated people, there's a problem, people are lonely, we'll commission a service. We've commissioned that, you can use that. And actually I knew what I needed in my life. I had friends, but they didn't actually listen to what I knew I needed. And that, I think, comes down to trust. So I think what I would like to see is that families and individuals are trusted to be the experts in their own lives. More people are given control over that money, either in the form of a direct payment, but given support in how they manage that. So there's less of a burden on people and less rules and bureaucracy around people using that money. Because actually, if individuals started buying services that they wanted, that gives people power then. And also, I think quality would have to improve, because we would vote with our feet and we wouldn't be choosing things that currently are commissioned. And I also want to say that actually there are some brilliant things happening now. This is TLAP and SKY's, I call it rainbow, but innovations and community support. And despite the lack of money and the current system, these small things are working and doing amazing things, but they need a system that supports them and nurtures them and allows communities to find their own solutions. And at the moment, we're not doing that. So I think there needs to be a space for these things to grow and be valued. And then the next thing that is often talked about is this word integration. And everyone says, oh, we just need some integration and then everything will be solved. And, you know, this is me, and I just put a few of the people that I interact with on a monthly basis, you know, GPs, physios, OTs, it just goes on and on and on. And it's exhausting, and I feel like I'm a full-time care coordinator. But I don't think necessarily, well, I don't think that one massive national care system is the answer, combining the NHS and social care, because I think they do really different things. And as somebody that used to work in the NHS, and I love the NHS, but I can tell you that the culture in the NHS is very different to social care. The NHS is good when it wants to fix you. Social care is about people living their lives. And I worry that social care would become quite medicalised and might get lost in this massive thing of the NHS. And actually, you know, I have 7, I think, different consultants at the moment within one acute trust, different specialists. And they don't talk to each other and they don't know what each other are doing. So I don't think that just shoving social care into that will help. What we need to be doing is actually working out ways that those people are working together better. And they need to be working around me and my life. I call it team manner. They need to be looking at my well-being as their priority, not individual targets and different things. And they need to be thinking about how their bit joins in and how they all speak to each other. In the end, I called an MDT of my life last year. It worked quite well, but most people don't do that. But I think integration as just this thing and creating more structures won't solve anything. And then finally, you know, I put this up in a lot of my talks, because if you read my social care assessments and my health files, you know, you wouldn't know anything about me as a person. You'd just know all my conditions and you'd know how I ate and showered, but you know, you wouldn't know I like taking photos of flowers, for example. And that's what social care is about. It's about lives, ordinary lives. It's about me as somebody in my 30s being able to just go out and do normal, ordinary things. It's about somebody in later life being able to keep the connections to the people that they care about. And at Social Care Future, we created this vision for social care, but actually doesn't talk about social care. It talks about what everybody wants from their lives. And I think COVID showed us these things really matter. But what we know is that once you enter services and you need some support, these are the basic things that often you lose choice and control over. And we held an inquiry that was led by people with lived experience called Who Social Care Is Anyway. But what people told us they wanted was these 5 key things to living an equal life. You know, they didn't feel that they were part of the community. They didn't have choice over where and who they lived with. They wanted to be able to lead an ordinary life and do the ordinary things. They did want more money, but they wanted it to be spent on things they wanted, not to have to fit into council's view. And then the final one, again, about power, because I think that's fundamentally where this comes back to. Who holds the power? Is it the state, or is it individuals that actually know what we want from our lives? So that's all from me, and I will pass back over. I'm not sure who's next, but thank you.
Brilliant, Anna, that was absolutely amazing. I think really powerful hearing it from your perspective, someone that's using the system. And I think a really kind of inspiring take on what we should expect. The things I noted was that point you made about trusting the users and the power imbalance that we need to get right, the space for community-based solutions, and integration around your well-being. It feels like the building blocks of the sort of system that we should move towards. Can I sort of hand over to Dan to build on that, and maybe talk a little bit about why the system needs reforming, and a little bit about what we're proposing in order to respond to, if you like, the vision that Anna has set for us.
Yeah, great. Thanks, Miatta. So I'm going to start just by outlining what we see as the sort of range of issues facing social care. And then I'm going to move on to talk about some of the solutions that NEF and the Women's Budget Group propose in our new paper. Now, I don't want to dwell too much on the sort of problem and the doom and gloom of the current system, because, yeah, when we hear about social care in the news, this is what we tend to get, and that can be unhelpful, I suppose. But I think it is necessary to start by listing the issues facing care, since a key downfall of many of the other proposals on offer, not least the government's, is that they only tend to deal with one issue or maybe two issues in isolation. And what we need is reform of the social care system in the round. So this was one of the key reasons why we wrote this paper, to think through what more transformatory reforms of social care would look like in the round. So first off, at the moment, we've got a system that's means tested. It's also vastly underfunded. And that means that too many people go without the support they need. Lots of people are locked out of the system and either don't have enough care or don't have access to care at all. We've done a little bit of analysis to look at how many people do have unmet care needs. And we find that there are at least 1.8 million people with unmet care needs in England alone. And that figure is actually likely to be much higher in reality, given the sort of constraints of the data we're working with. And that's really quite shocking and unacceptable, I think, in a 21st century society. As a result of that, the system relies on family and friends providing informal care, and that's often with sort of little or no support. So at the last census, there was around 6.5 million people with informal caring responsibilities. And that's thought to have increased a lot since then, especially since the beginning of the pandemic. So more people are providing unpaid care, people are providing more hours of unpaid care as well. For those who are able to access care services, the quality is often not good enough. People, have little power over what their care should look like, what it should aim to achieve, and how it should aim to achieve that. And Anna's already described really powerfully what that looks like and what that feels like. And finally, and importantly, we know that care jobs are low paid. They've often got poor conditions as well. And that leaves services subject to high vacancy rates and turnover rates as well. And that further impacts the quality of care, because good quality care is dependent on relationships between people. And those are quite hard to build when you've got this constant churn of different care staff. So that's a quick run through of the gloomy bit. What I want to focus on now is what reform should look like. So in our view, what's needed is a universal care system where support is available to everyone who needs it, regardless of the ability to pay. So here the state would be responsible for social care funding and ensuring that there is comprehensive care on offer that's free at the point of use for the individual. So in our view, this is the fairest way of funding care, since the costs of needing care should not lie where they fall. And I think most people agree with that. It's also the most effective way of meeting needs. So, care needs are a normal risk of life, but the uncertainty around if and when you'll need care and how extensive our care needs might be mean that sort of any model in which people have to pay for their own care there'll be some that go without it when it's needed. And again, that's not acceptable. So while we are calling for universalism, this must not mean one size fits all top-down services, nor just better access to the system as it is. So we're calling for universal quality social care, where those working in the sector also get a better deal as well. So a key criteria for reform for us should be to close the gap between the reality of social care provision at the moment and the vision set out in the Care Act's wellbeing principle, where care aims to help people to achieve the outcomes that matter to them. So we don't just want better access to the current system, we want better access to a better social care system. In terms of how we get there, the tricky bit, so we propose three main things in the paper. So first off, we are going to need a much more generous funding settlement in order to expand access to care, to abolish the means test, and to pay staff the minimum of the living wage. So we've done some calculations which show that we need to increase the budget by over 2.5 times what it is currently to get there. And Jerome's going to talk about that in a minute, so I won't steal his thunder too much. So that is quite a big investment compared to where we are currently. And it's quite a lot larger than some of the other proposals that have been proposed, but that is necessary funding, but it's also affordable and it can be raised progressively. So we've set out some examples of how we can do that, how we can raise that revenue in the report. So one option would be to reform national insurance contributions by removing the exemption for investment income, and taxing high earners the same as lower earners. So that's one option, and that would raise enough money to fund what we're proposing. Another option would be to start to tax wealth on a similar basis to earnings from work. And I know that's been proposed by a number of other organisations as well. And again, this would raise enough money for what we are proposing. The second thing we propose to get towards our universal quality social care service is that local authorities work really closely alongside those needing support to develop long-term strategies to shift care towards well-being. And we think key to that will be putting co-production really at the centre of care services. So that's when people using services and people working in them have much more power and control over what those services look like, what they should aim to achieve, and how they should aim to achieve it. We also think it will require a shift away from private for-profit delivery of care. So that's the model that currently dominates, towards non-profit models, which could include cooperatives, disability-led organisations, and community-based providers. It could also include a much greater role for local authorities as providers, but as long as they develop a culture of working co-productively with people. We think that's a really key element here, is that sharing of power with people. And finally, we set out some proposals for a new national body to drive improvement, which we're calling Social Care England. So this isn't the NHS. We definitely agree with Anna that integration with the NHS isn't necessarily the way to go. But we do propose a new body, and that would work with local authorities to transform social care provision. It would set and enforce high standards for both care quality and job quality, and it would share and spread good local practice. So care would be sort of organised locally between local authorities and people using services. And then Social Care England, this new national body, would raise revenue and oversee standards and share learning between places. So that's a very quick run through of some quite wide-ranging proposals, and there's a lot more detail in the paper, so please do have a look at it, and the link should be in the chat. It'd be great to hear what you think.
Great, thank you so much, Dan. That point about it's not just about access, but it's about quality, I think is absolutely critical. And for me, the three pillars I took away: more funding. Jerome, you're going to tell us how we're going to do it. The second is the shift towards well-being and co-production, and that point about power and making this a sort of partnership with the user, and a shift from the kind of towards a not-for-profit model, and then a national body that's driving standards. I think the building blocks are something that feels concrete, it feels feasible, deliverable is there. how are we going to do it? How are we going to, what's going to cost us? How are we going to pay it? Is it achievable, Jerome? Can I hand over to you?
Thank you. I'm going to share my screen to show some slides. Yeah, that's it. I hope you can see and then start. Yeah, so I'm going to mainly talk about the costing side, not so much the funding and how money can be raised, because Daniel has shown some of the avenues, and also there are so many different options available to the government, many more than we think, actually, many more than what is in the debate. So here it is more about what's needed. So it's trying to start from a needs perspective rather than what generally is talked about, which is what we can afford. So let's talk about needs, and let's talk about, obviously, how to translate those needs into some kind of understanding of how much spending would be required every year. So it is a very broad brush exercise in the sense that it doesn't cater for all the subtleties of what it means to provide high quality care, but we have retained some of the main parameters that are often associated with better quality, such as having enough time to care, providing high training and skills to the carers, recognize their training and skills by paying them more, and also extending the definition of needs, especially in that perspective that was talked about earlier, and Caroline Glenning in the chat reminded us of as well, that a lot of the early interventions help also with preventions, and especially in the sense of not having aggravated needs further down the line. So we have taken that into account as well. So to start with, what we work from is the current system in terms of those main criteria is very much following in principle the Care Act, but with strong rationing happening in practice, especially since the austerity of the last 10 years, where local authorities' budget were reduced, and they had to interpret the Care Act more stringently, which combined with a means test in what was offered, would reduce the amount and the scope for needs that would be provided for. And we've heard from Anna that in concrete terms what it would entail for different individuals. The current funding is actually very narrow compared to the population that potentially have care needs, which is often taken as the population that reports having severe functional limitations in their day-to-day activities, which is about 8% of the working age adults and 24% of the over 65 in the Family Resources Survey census, which is a household survey that happens every year. And compared to that, the percentage of people who are receiving funded care, so publicly funded care, not those who fund their own care entirely, is about 0.8% of the working age population, so 10 times fewer than the potential population, and about 4% for the over 65. So it's much smaller than the potential population. Obviously, not everyone with a severe disability or who is severely disabled would require the same amount of care, or even personal care. It may take different aspects such as equipment or adaptations, and also a lot of it is to do with the environment and in terms of the infrastructure around us, etc. So, but it's still a good proxy for care. And this translates into a number of full-time equivalent care workers. There are about 1.5 million care workers, but in the sense of those who are in full-time equivalent first, and in terms of those who are looking after patients and clients who are funded by local authorities. It's about 500,000 for the sake of our estimation. And the unit cost about £20 an hour. This is actually higher than what the local authorities get to commission, but this was based on the kind of minimum criteria that were available in terms of the pay rate, the number of hours that are counted in the pay rate, the type of pension provision, etc. So this is to give you the kind of baseline from which we build a better system in terms of costing. The two scenarios that we have estimated was to extend the definition of need. So the first one, the core scenario, would be the Care Act without rationing, where, as Daniel said, it would be available for free at a point of use, so no more means test. And we add some preventative visits, like Denmark's care model, where every person over the age of 65 receives 2 visits by a specialized nurse in order to assess potential needs or everything to do with their life and health and other aspects of prevention activities. And then a transformative scenario, which includes wider needs, because the Care Act has still a narrower definition of care needs. Here, the transformative scenario would be anyone with any needs in terms of any limitation in terms of their day-to-day activities would be considered, which is more in line with what the Scandinavian countries have. To anyone with some needs would be offered some support, as well as preventative units. So what does it translate into? It would be that the population that would be reached by those wider definitions in the core scenario would be twice as much for the working age population and 3.5 times as much. So about 13% of the over 65 would qualify for such interventions and support in their day-to-day lives. And the transformative scenario, even wider, would cater for 5% of the working age population and 17%. And this actually corresponds to what we could estimate as more or less the population that would have care needs, but also taking into account the likely take-up of the services, because obviously people have different preferences. Some prefer to be looked after by their relatives. And here we are providing the basis upon which the universal system is constructed that doesn't require informal care, unpaid care to be provided. It could still be provided on top or instead, but it would not be forced upon anyone because of lack of other options. So it's to create this synergetic transformative scenario. And in terms of funded care workers, the workforce would increase by 2.6 times or 3 times. Obviously, the relative increase compared to the increase in the number of beneficiaries in the transformative scenario is less, because by including the wider needs, they require fewer hours per week. But we'd still end up with 1.4 million full-time equivalent care workers in that sense. And the unit cost, which for the core scenario, as Daniel said, we would have the living wage as the minimum wage, and add better conditions in terms of pension contributions, also better conditions in terms of the time that is counted in their pay to deal with the commuting time controversy, which would increase their pay by 40% or the unit cost by 40%. And in the transformative scenario, where we aim for better training and qualifications that are therefore reflected in the pay, the pay would rise to reach the similar levels to the Nordic countries, where personal care workers are paid about 75% of professional nurses. And that would entail an increase by 80% of the unit cost of £34 per hour. So how does that aggregate into the total spending per year in this financial year as a benchmark in terms of a price? So the current spending is about £20 billion that you can see in the left-hand side of the figure. And then the core scenario would increase that budget by £32 billion per year. And it's composed of these 3 elements. So extending free care to everyone, so abolishing the means test, considering that because of that there would be an increased take-up in the people applying, because means test is not just restrictive in terms of entitlement, but it also creates difficulties for people to know about it, and therefore the take-up is not as much as it could be. and then 12 billion for an improved pay to the living wage as a minimum. That would represent about 2.8% of GDP, which is much increased from the 1.1%, but still well below the levels at the Nordic countries. And in a further scenario, we would have 18.5 billion on top of that, to include the better training and pay and increase the scope of needs. And that would take us to about 3.8% of GDP, which is in line with what is spent in the Netherlands, Norway, and Sweden when we account for the part of the co-payments by users. And to compare with what's currently being proposed or planned, it's just to see the scale of the distance that we're talking about. This is a graph that projects the current government plans, the lower bar, current plan, to 2032 to 24 billion by then. And our core and transformative scenarios show that it's much higher what is planned. But even for the other organizations, such as the Health Foundation, that suggested a plan that was talked about a lot in the media when the Social Security contribution changes, the National Insurance contribution changes were presented in October. Their scenario, the comparative scenario, the yellow line on 27 billion in 22 to 38 billion in 2032 shows that even that is still very much far away from a decent minimum. Our scenario is not at all inclusive of everything that's needed. It is an illustration of a focus on wider needs, better pay, and a universal access. But there are other aspects to a better care system that were not costed, such as changing the way we live and community organizations of community living. So these are still illustrative and yet very much higher than everything that is being currently mooted. So it's important to set the bar where we think that a real change can be made, and then talk about how this could be funded. So Marianne now we'll talk about how to transform a vision about what it means to spend on social care in order to change the narrative around this.
Brilliant. Thank you so much, Jerome. Lots of sort of comments in the chat about how persuasive the numbers and the analysis is. And I think the thing that really struck me with what you said was it's so logical and intuitive that you should start with the needs and you work out what you need to fund the system based on that, rather than this very bizarre way that we do. And that even with the core scenario where we're talking about an extra 32 billion, it's still less than we're seeing in other Nordic countries. I think putting it in that perspective is really, really persuasive. So we have the reforms. We have a sense of how they're going to cost. We have a sense of how we might pay for them. We've got the vision that Anna set out at the start. Marianne, can you sort of round us up with the case for investment? This for me seems so logical, so intuitive. Why are we not already here? And how do we make the case to shift the debate?
Thank you very much, Miatta. And it's really good to be able to come after Anna, Dan, and Jerome, because they've really set out the problems with the system, the need for reform, and Jerome set out that kind of detail of a sort of two-stage model for transformation of the care system. So I've kind of been asked to make the case for investment that's needed to fund that transformation. And in particular, I want to talk about why we should see this as an investment. It's an investment in the sort of care we would want for ourselves and those we love, an investment in jobs, and above all, an investment in a caring economy. As we always emphasise at the Women's Budget Group, and for those who don't know, we work to analyse economic policy for its gendered impact and propose policies that promote a gender equal economy. And we always emphasise that all policies have a gendered impact because women and men are situated differently in the economy and society, with different patterns of paid and unpaid work, earnings, income, wealth and poverty and so on. And with care, the gendered impacts are fairly obvious. Women are more likely to need care. I mean, this is something that I've noticed coming up in the chat. The vast majority of care workers are women, and the majority of those providing unpaid care to relatives, partners, friends and neighbours are women. And as our Commission on the Gender Equal Economy reported last year, unpaid care is at the heart of women's economic inequality. Women do 60% more unpaid work than men, mainly care work or work associated with caring for others, which leaves less time for paid work, which means that women earn less, own less, and are more likely to be poor. But I think care isn't just important to us because it's a gendered issue. We all need care at some point in our lives, certainly when we're children, and most of us at points later on in life. And most of us will provide care for someone else during our lives. Caring and being cared for is a fundamental part of human life, and it should be central to the way we think about how we organise society and the economy. And this project grew partly out of a recognition that the social care system was in crisis, but also out of frustration that discussions about social care reform seem to start and end with a single question: how do we pay for it? And I think Anna set that out brilliantly at the beginning. Actually, the current government's question at the moment is more, how do we prevent people from having to sell their homes to pay for it? But either way, the primary focus, the start and end point of the discussion was about covering the costs. And that's clearly the wrong place to start. The fundamental question, as other speakers have said, should be, what is our care system for? What are we trying to achieve? Then we think about how the system needs to be structured in order to do that, what this would cost, and then finally, how to pay for it. And I'm really glad that Anna shared that quote from Social Care Futures, because I really think that is the best answer to the question about what is our care system for. You know, we all want to live in a place we call home, be with the people and things that we love, and do the things that matter to us in communities where we all care about and support each other. And that means, rather than talk about how to fund social care, we should be thinking how to invest in all of our futures. Because spending on care is an investment. At the Women's Budget Group, and we're not the only people who've done this, but we've been doing this for years, arguing that care services should be recognised as a form of social infrastructure. So when we talk about infrastructure, what we mean is both physical structures, things, roads, railways, bridges, but also social services, healthcare, social care, and education. And we call them infrastructure because they go beyond benefiting the immediate service users. So it's not just the people who are using that particular service, travelling on that road, that benefit from it. And they have a broader positive impact on a wider society over time, not just at the time the services are being used. So just as we rely on physical infrastructure such as roads and rails, not just for our own travel, but because they're a way of transporting the goods we want to buy, they're a way that our colleagues, the people we work with, can get to work, the people that we buy goods or use services from can travel to work. So we rely on social infrastructure. We all benefit from health, education and care services, not just for ourselves, but for the wider society, the wider economy. And I think we really saw that with COVID, when we started to realise, you know, exactly what parts of the economy are fundamental and what parts can we not do without. And care, both childcare and social care, suddenly was put in the spotlight. So in the UK, investment in care is a way of tackling the inequality that arises because of illness or disability or age, which means that some people need support to be able to choose to do the things that other people can do unaided. And it would be a way of ensuring that people's needs are met in a way that, as far as possible, gives them equality in their life chances and dignity and control over their lives. And again, Anna's presentation summed that up really well. You know, if what you want to do is to spend time with your friends, then you need support to do that. You don't need a befriending service. But it would also enable unpaid carers, as Jerome said, to provide care without it reducing their own life chances. So ensuring that good quality care was freely accessible to all who need it means that those people who are currently providing unpaid care can do so if they wish to do so out of choice, or provide different sorts of care, or spend time with a loved one or family member, rather than feeling that if they don't provide day-to-day care, it won't happen. And this investment would also ensure paid care workers are treated as skilled workers with decent pay and conditions and a proper training structure. And this in turn will help address the severe shortage of care workers and reduce staff turnover in the sector. And I picked up on that point that was made in the chat, that just paying the real living wage in itself may not be enough to deal with these problems of recruitment and retention in the sector. And that's one of the reasons why we're modelling higher levels of pay based on what happens in the Nordic countries, where carers receive about 75% of nurses' salaries. But we need to reduce that turnover. We need to deal with the shortage of care workers to improve the sort of continuity and the relationship building, which is critical for high quality care. It's not just bad for paid care workers if they're paid badly, it's bad for the people receiving care if they don't have continuity of care, if they don't know who's going to be coming to see them next time. And this investment brings wider benefits. So good quality social care services are preventative. As Jerome said, expanding the sort of wider needs model means that less has to be spent on health and other services to deal with the impact that's currently caused by unmet care needs. And also that people are able to move out of hospital, for example, more quickly than some are now if they have a proper care package and care support in place. And social care services could also free up many unpaid carers to participate in the wider economy or in the wider community. An investment in care creates jobs. Research that Jerome did for the Women's Budget Group and the ITUC showed that investment in the care sector across a number of countries created significantly more jobs than the same amount of money invested in construction. Most recently, he did work as part of a report that we published on a care-led recovery from COVID, showing that in the UK, investment in care could create 2.7 times as many jobs as the same amount of money invested in construction. And jobs in the care sector are less polluting than jobs in construction. So investment in care is central to action to tackle the climate emergency, which is another crisis that we are facing and that we need to address. Care is one of the sectors that we need to grow as part of any plan for a just transition of the economy. An investment in care would create jobs across the UK, but particularly in poorer areas where the unmet need for care is greatest. Care workers tend to work locally. So unlike, for example, investment in a big construction project where you may have companies coming from outside the area and indeed workers coming from outside the area to complete the project, care workers tend to work locally and spend money locally. So money from care work tends to stay in the local economy. And if, as we propose, these jobs are good, well-paid jobs, that would help reduce regional inequalities. So there's a strong economic case for investment in care. Of course, this isn't the primary case for investment. As I said at the beginning, this is about the sort of society we want to live in. And sometimes I think there's a bit of an artificial distinction between those two. We sometimes talk about, the moral case and the economic case, or the social case and the economic case. But I think this reflects a really limited definition of the economy. The economy isn't just about goods and services sold in the marketplace. It's not just about GDP and paid work. It's not just a black box, something we can't understand or influence, something that's separate from us over there. We are the economy. We can do things differently. As we come out of the immediate COVID crisis in the UK, we need to ask what kind of world we want to create, what kind of economy do we want to make? And I'd like to end with a quote from our Commission on a Gender Equal Economy, which reported in 2020, which said, "We can design and demand a new economy, an economy which has the well-being of individuals, communities, and the planet at its centre, an economy which values care, both paid and unpaid, as the activities that nurture us all, an economy which ensures that no one faces discrimination, violence, or poverty, and which no one is left behind or pushed behind. This new economy is a caring economy, and investment in care is at the heart of creating that sort of economy." Thank you.
Amazing. Thank you so much. What a fantastic set of contributions. I'm going to move us on to discussion and question and answer so that we have some time to kind of knock through some of the issues. There are already some questions in the Q&A. Would encourage people to add in further questions. But if we sort of kick off, Janet has asked the first question, and Anna, if I can ask you to pick up this one. And her question is, Anna talked about giving people the money to buy their own services. What would need to be done to make this work? And reflecting on the experience of her mum and dad in particular, I think Janet asked whether we would need advocates in order to support people find the best provider and navigate through the system. So that's the first one for you, Anna. Jerome, if I can ask you to pick up this question about the nitty-gritty of how we fund this. So a question from Anne, given the escalating demand for care, aging population, greater mobility, what tax sources can be sufficiently dynamic to provide revenue that grows at an adequate rate? How do we ensure that we're not setting ourselves up for a kind of a funding solution now that dies down in 20 years' time? How do we ensure that it's dynamic? There's a question for Marianne, because I think this speaks to some of the points that you made from Sally. Politicians want easy, big solutions, ideas that can be bigged up. However, the majority of the solutions discussed, and which she prefers, Sally, I agree with you, are about smaller, local, cooperative, not-for-profit and individualized solutions. How can we shift the discussion nationally to make these alternative methods more politically relevant? And then finally, a question for you, Dan, from Brian. Who says, look, Dan explained that these plans assume a trajectory towards non-privatized provision. The current system is 90+% privatized. How would we move towards in-source publicly provided provision? So if you could sort of take it in that order, and then we'll take the next round after that. Anna, over to you.
Yes, I totally agree that actually there would need to be some really fundamental changes to the way that the system currently works, because I often say that I feel like direct payments are a punishment for having the audacity to want choice and control over your own life. And I take a direct payment because I had a care agency for a little while, and you know, different people would come and they'd come at different times and I wouldn't know who was coming, and you know, it was totally inflexible. However, you know, effectively I have become a little business without ever wanting to set up it as an organization. You know, I have to have, I'm about to go and try and recruit for 2 more PAs, so I have to do all that. I have to, I don't do my own payroll, but you know, I have to sort that tax, all that kind of stuff that frankly, you know, I don't have a clue about. And I do it because I want that choice over who comes into my house, but I wish I didn't have to. And I think, like with so many things, the council has commissioned a support service, I use inverted commas, because they're really not very good. And that's because they bid for a massive contract at the lowest possible price. And I think what we need is we need better support. We need that to be prioritized so that there are different options for different people. I think people should still be able to choose. There should be an in-between for people that don't want to have the direct payment and, you know, all of that responsibility, but actually still want to choose who comes in. And there are ways, like there's people like Community Catalysts who are trying to get people in areas to sort of register as almost like self-employed PAs. So in a sense, you don't become the employer. There's co-ops setting up in parts of the country, but again, they're very small and they're very patchy, and we need to take that burden off individuals. But yes, so I agree, we do need to change.
Brilliant. Jerome, do you want to pick up the tax question?
Yes, I mean, the tax question is the million-dollar question. Indeed, it's there are different solutions. I think, given demographic changes, given the imperatives that the climate and the environmental crisis is imposing, we need to move away from a growth imperative. It's going to be all about redistribution, much more than growing the pie in order to redistribute. So there will be a lot of different structural changes to be considering. I agree that in the sub-questions, not all those taxes have the same level of sustainability, but it doesn't mean that they are not the best instruments in a mix. So we need more general taxation. There is so much more margin that can be had. And especially if we are considering a smaller working week, paying very high income, very high taxes at the top helps reduce that incentive to increase money. So it's not a bad thing. There will be more time to care if you have more time away from paid work, and the redistribution of care amongst the men and women, which is also helpful. It doesn't mean that the costs of providing quality care will raise forever. There will be a change in the average wages relative to the population, depending on how our economy evolves, and that's fine, because the care wages will be well paid according to the average, even if the average is reduced because we are in a different kind of economy in the future. So that's not a problem of sustainability. But what's definitely the case is that there is so much wealth inequality that can be tapped into for all the reasons about distortions, about as you said, the regressive nature of council tax that can be reformed, a better understanding of land value, a better understanding of the actual unearned income, how it is produced, and who benefits most without necessarily contributing much. So there is some scenarios have estimated the potential for this to fund far more than those already big numbers that we've shown in terms of taxing wealth, and it can be done progressively. Obviously, it will need a very strong change in the regulation about tax haven and other aspects of tax evasion. So all of that is needed, and those reforms are needed independently of the fact that we need to fund the social infrastructure on a sustainable foot. They are needed for equality reasons, for inefficiency reasons, for the resilience, etc. But they are totally possible. So having a mix helps also reduce the risk of having one population against the other, or changes in the economy. And that mix can be provided by all those reforms at once, without necessarily imposing a heavy burden on a particular individual having to fork all that. But there is still very much room for much more redistribution in this country because of that.
Brilliant. And just because Stephen's asked a specific question, which I think is sort of built into your response, because actually you can think about different forms of kind of wealth taxation, but he has asked, why is nobody talking about a land value tax? So I'll throw that question directly to you as a sort of supplementary. Yeah, totally. I mean, the land value tax, it's not necessarily the best tax to, but it's about the fact that, you know, people own land that is in itself not productive, and yet they're earning a lot of money out of it because of the price rise. But the problem is the asset price inflation of land, which is problematic in its own right. So it's not like if we have a land value tax, it will be more to curb that unpredictable price rise that has no sense in a sustainable economy, rather than to find sustainable resources, because it's a bit like a tax on tobacco. The aim is to reduce tobacco consumption rather than tap into a huge sustainable resource. But relative to that, the unearned income from property, so any type of property tax of having several houses, of renting, or even owning your own home, you get services out of that, which could be taxed. Some countries they are in a much different way than council tax, because council tax is outdated and very regressive. So reforming that as a package could help. But also the inheritance tax needs to be reformed into more of a progressive income tax on receipts rather than on bequest. So there is definitely so many opportunities. I think there are
people from Tax Justice UK here in the audience. I saw Sarah Hall was there, and they have lots of ideas about that. So feel free to join their call.
Brilliant. Dan, do you want to pick up?
Yeah. So there was a question from Brian, wasn't there, about, it's quite a good question, quite a tricky question about getting beyond the private market approach to social care. And that is, yeah, it's tricky because of how entrenched the current delivery model is. So sort of repealing those processes, I think, should be the goal, but change will be gradual. And I think there are a number of things that can be done to get us towards that goal. So local authorities commissioning care, for instance, can start to use like a form of ethical care charter or a preferred provider strategy, which would favour providers that meet certain criteria. So that could be providers that pay sufficient wages, or providers that are accountable to those needing support and are working in co-productive ways. We could give local authorities the power to buy out providers that are either failing or consistently providing poor quality care, and they could either run those sort of co-productively themselves or hand them over to more suitable care organisations to run them better. And then over time, we can expect, I think, local authorities to use a growing share of the increased funding settlement they'll receive as part of this universal care service on the public sector and the cooperative and community-based sector as well, while also sort of supporting the number of providers in that area to grow. So yeah, there's definitely a role for local authorities to nurture different types of providers and provision, and then to directly fund them over time when that becomes an option. But not an easy question to answer.
Thank you. And Marianne, I asked you to sort of pick up the question about politicians liking big solutions and how do we get them to wise up to the alternatives. Can I also throw in Anna Rose's question as well, which is, how do we get these ideas discussed, taken seriously by government? Many of us on the call have lived the difficulties of our current system and are bursting with knowledge and ideas, but we need to create the political will to address within the current vacuum. So if we could respond to both of those, which I would think are sort of two sides of the same question.
Yeah. I mean, I think Sally's question is a really interesting one, and some of the things that Dan talked about in a way relate to that, because if you're talking about how do you create those sort of small scale cooperative co-produced care services, some of that is about giving local authorities not just the power but the responsibility to actually make that happen. But in order to get there, you kind of need to have the political will in the first place for people to see that's worth doing. And I think it's true that there is a tendency sometimes to go back to this kind of integration with the NHS thing, because the NHS is something that we feel like we know, it's there, it's lasted this time, it is underfunded, but it's not facing the same crisis that social care has, so people kind of think somehow if you tie the two together, that will help social care. I agree very much with Anna that, it's not the solution, and there is no guarantee that there will be better integration by tying the two together. But I do think it leads to that kind of mindset that either what you've got is actually politicians wanting to do something that's relatively small and ineffective. I mean, the government's proposals in terms of the increase in national insurance contributions and the amount of money that will raise are minuscule compared to the size of the problem. Or when they're thinking big, they think big kind of national care service, part of the NHS. And I think, a key part in that is working to make sure that the voices of people who are using care services are actually centered in this discussion, and that, Anna and her colleagues in Social Care Futures and all the other organizations and networks that are out there are the people that, the rest of us who are concerned about social care should be working to promote and make sure those voices are heard, because then you hear the concrete examples of why it is important that services are responsive. saying we need responsive services in the abstract, everyone goes, oh yes, of course. It's only when you get to the specifics of, look, this is what I needed and this is what I was offered, that you start to kind of realize that gap. And that's partly about how to get these ideas discussed and taken seriously. I also think that care suffers from a problem. It's a similar problem actually to pensions policy, which is that thinking about it involves a lot of people thinking about stages in their life they don't want to have to think about. And so, you know, nobody wants to think that they're going to get old. Nobody wants to think that they're going to need to be cared for. And we have a whole discourse around independence and self-sufficiency, and a move away from a recognition of interdependence and the fact that we all rely on each other all the time in all sorts of different ways. And so I think that, you know, it is hard because it does require people, and most people actually think that if they've got care needs, it'll be like the NHS. Most people don't realise the state of the care system until they or a loved one needs care. And one of the problems, and it's always this thing with political messaging, is that if you're focusing on the problems with social care, the temptation for people is to close their ears, because it's too big and scary to think about. When they hear horror stories, they think, oh, I better not think about that because that might happen to me. So the safest way to protect myself is not think about it, which makes political engagement difficult. So I do think that focusing on that kind of positive vision, what sort of society do we want to live in? What sort of society do we want, you know, not just for ourselves, but for the people we care about? What would that look like is probably the best way to start the conversation. Even though for those of us who you know, involved in campaigning in different ways, the temptation is always to start with, this is how awful the situation is, and this is what we need to do about it. And actually, I think, you know, the vision is probably the thing that helps people feel safe enough to engage with the conversation, to actually start thinking about it, which is what's needed as the first stage before people start pushing for change.
Brilliant. Thank you so much. We've got more questions coming in, but I'm incredibly conscious of time. I think we've had an absolutely fantastic discussion. Thank you so much for all the questions, all the kind of comment in the chat, and the contributions from colleagues across the piece. I'm going to throw, if you like, I'm going to be cheeky, and I think I've got a minute to play with. So I want to throw the last question to Anna, because you started us off in this conversation. I'd love for you to kind of wrap us up. And it's a response to, just trying to find the question, I think it's been answered. So Jerome's answered it, but just a response to a question asked by Caroline, and a bit of advice for us at NEF and the Women's Budget Group. Publication proposals on social care reforms have been published for at least 2 decades. It's already a crowded field. How does Women Budget Group and NEF plan, or how should we plan to promote these arguments in order to influence the debate and land big change? And a bit of advice to finish us off.
I think really following on from what Marianne was saying about what's been happening in the past hasn't worked. You know, these conversations have been going around for a long time, and we've seen similar things to what was in the white paper. We have a care app, you know, we need to think about trying to do things differently. And I think we need to get, from my view, the wider public to feel ownership of social care and care about social care, and understand it enough that they will write to their MPs about social care, and that they feel it's about everyone and not about people over there. Because until we all feel a sense of this isn't good enough and we want to see change, and that is about then portraying the positive alternative, I don't think the political pressure will be there. So I think it is about getting a wider consensus about what we want.
Brilliant. And winning that coalition for change. I feel really inspired at the end of this. And I think for me, the big themes that I think have come out of the conversation is, you know, that point that you made, Marianne, like caring is absolutely universal, because everyone will care or need to be cared for. it's a service that we will all have to interact or access with in some form or another. So if ever there was a case for universal service, surely this is the one. And at the heart of that has to be about well-being and putting people's well-being. And Anna, I think the vision that you set out at the start, if you like, the sort of parameters and pillars that your organization are campaigning for absolutely must be at the heart of the thing that we work for. I'm encouraged because, you know, we often look at the problem and despair, but it's hard to reach for a solution. I think, you know, colleagues on the call have set out a solution that is universal. It's about access, but it's also about quality. It is attainable. Yes, you know, a 2.8% GDP uplift on where we are feels big, but not in comparison to where other countries are. And the arguments that have been made about this isn't just about funding and spending, it's about investment, it's about social investment that will reap huge rewards, I think are compelling and I think are persuasive. And the pillars of that model, more funding, I think is indisputable. A model that's based on well-being, it's based on co-production, it goes back to that point about power and the partnership between the user and the provider, and provision that's not for profit, but based on more local, more cooperative, more mutual, more not-for-profit solutions, and standards and driving up standards through a national body. It feels tangible, it feels clear, it feels attainable. But I think, as many people have said, we now need to turn our attention to how do we win the debate on this? How do we shift from the technocratic arguments about solutions that don't really get to the core of the problem? And how do we begin to build that powerful coalition that I hope many people that are on this call will be part of, to advocate, to campaign, and to push for the change that I think so many of us need. So it is amazing to be part of a conversation that sheds hope to an area that often feels quite despairing. So thank you all to our fantastic panelists and their contributions, to everyone that's taken part in this conversation and has provided comments and questions. And I hope this will be the first of many conversations we'll have as we try and work together to make this ambition a reality. Thank you and have a good day.
Thank you.